think as women, we should also feel empowered to be our own advocates when we're in the medical office, when we're consulting with our doctors. What are some of the kind of questions that you would encourage or empower pregnant women, female Caribbean patients to ask when they're having that conversation with the doctors about the benefits, the risks, when it comes to making a decision about their bodies?
Well, firstly, I would encourage women to know one basic thing: their last menstrual period and when is their due date. So many of my patients would come into the room and I ask them this question and they don't know. So having that information is the first thing.
Nice.
What is your first day of your last menstrual period and when are you due? And then I want you to be able to tell me your history, right? Your history is, your medical history is a very important tool in being able to determine your risk factors and how we are able to manage your pregnancy. And so once you are able to express your medical history, you are then able to ask questions related to yourself. So know yourself. And then when a doctor gives you an advice or a management plan, feel free to ask why.
Yeah.
In my training, one of my consultants would always ask us during rounds, what will you do and why? And in us being able to answer that question, we are able to counsel the patient. And it is the patient's right to ask me, what am I doing with their care and why? The patient should also be able to have some sort of say in terms of interventions that may be required. As I tell my patients, the information that I am giving you is for your best interest. However, at no point in time is it something that you must do. But I am giving you all of the information to make a well-informed choice for your care and for your baby. And most times at the end of fully explaining everything to patients, they usually make the best choice.